Hi, my name is Dakota, and I am currently a junior biology major from Oklahoma Christian University. I hope to one day become a doctor myself, which is why today I will be presenting on how to have effective communication between doctors and patients. By the end of my speech, I want my audience to understand the benefits and ways to better communication between doctors and patients. Today, I will be talking about ways to better that communication by doctors speaking in such a way that can be easily understood by the patient, the importance of honesty, and how to deliver difficult news. Have you ever been to the doctor and not understood a single word they said to you about your condition? You may have felt overwhelmed or like your condition was more serious than it actually is. You may think you have cancer or you're dying, when in reality, you may just have a sore throat or an ear infection. If you didn't go to medical school yourself, you're not expected to understand the terms and jargon that doctors use. I was doing a presentation on gene annotation, and my lab partner and I were practicing in front of my roommate, who's an accounting major, and we were going to be presenting to people that aren't biology majors. And we presented, and we're like, hey, do you have any questions at the end? And she's like, I tried really hard to pay attention, but honestly, I didn't understand a single word you just said. So if you're not in that environment where all these terms are used a lot and normal to you, you're not expected to understand what they mean. So it's the doctor's job to make that understandable to the everyday person so you can understand what's going on with your condition. According to the Ochsner Journal, physicians have been found to discourage patients from voicing their concerns and expectations as well as requests for more information. If you don't understand what a doctor says to you, ask them. Ask them what it means. Don't be afraid of feeling dumb or like, I should know this, because you shouldn't. The next thing I will be talking about is the importance of honesty and trust in the relationship between a doctor and patient. As a doctor, you need to listen to your patient as they voice their concerns to you. You need to listen to what they want, to how they want to be treated, list them all their options, and help them decide what's best for them. Don't just tell them, hey, you need to do this. Let them have a part in the decision making and feel like their opinion matters, because it does, and they're the ones being treated. Patients, on the other hand, need to be open and honest with their doctors. Their condition may be embarrassing or really personal, but if the doctor doesn't know 100% about what's going on, they can't properly treat you and you won't receive the care that you deserve. So you need to be open and honest with them, and they need to listen to you and be supportive of you. According to the NCBI healthcare articles, it is important to involve the patient in the decision making. The treatment plan must conform to the patient's understanding, beliefs, cultural values, and concerns. Some of the treatment options may interfere with religious beliefs, which is why the doctor needs to give you upfront what the treatment involves and the recovery involves, so that way the patient can make the best decision for them. And if you are open and honest with your doctor and you trust them, you are more likely to follow the treatment plan and the recovery period. And if you and your doctor have that relationship, they will be willing to work with you more and you will recover faster in the end. The third and final thing I will be talking about today is how doctors should deliver difficult news to the patients and the patient's family. Sometimes patients have a terminal illness or cancer, and the doctor is the first one to find out, and they have to break that news to the patient and their family, and that can be really difficult. So they need to be empathetic and really, they need to tell the patient up front what's going on and ways to treat that, but they also need to be supportive and give the family time to process what's going on, because they're taking in a lot and it's going to change their lives. I was job shadowing an obstetrician and gynecologist over Christmas break, and this woman came in who was about 12 weeks pregnant, and today she was going to listen to their baby's heartbeat. And the doctor gets the ultrasound out, and she's trying to find the heartbeat, and they try several times, and there wasn't one because she had just had a miscarriage. So the woman's kind of freaking out at this point, not really sure what's going on. She's nervous. This is going to change her life forever. So the doctor tells her that she's having a miscarriage. Just take a minute. She calms down. The doctor goes and hugs her and says, hey, I'm here for you, whatever you need. And once the woman calms down, she goes and tells her options on how to deal with the miscarriage. And that's a hard decision to make in that moment when you're traumatized and scared. So the doctor just says, hey, go home, talk to your husband, give me a call, and let me know in the end what y'all would like to do. So she went home, and that's how she handled that situation. And seeing that, I think that's how everyone needs to handle those situations. So in summary, ways to better communication between doctors and patients are for doctors to not use medical jargon, but speak in terms that patients can easily understand, have an open and honest relationship between doctors and patients, and doctors need to deliver difficult news in a way that's empathetic and supportive, but also direct. Thank you.